and welcome to this week's Dermatology Flash Briefing. We're going to be talking about cystic acne in this episode, as well as this medication, isotretinoin, also known by its trade name Accutane or Oratane. Well, in terms of cystic acne, the key features that differentiate it from typical comedonal or other types of inflammatory acne is its tendency to form large, painful cysts that are filled with pus, may bleed, and cause significant pain and psychosocial distress. The most severe type of cystic acne is known as acne fulminans, which sometimes can lead to sepsis, where the bacteria spreads from the skin infection systemically via the bloodstream. Sufferers of acne fulminans are often very distressed because they wake up with blood and pus from the lesions on their pillowcases. And of course, they experience significant pain and psychosocial distress from the cosmetic disfigurement. Now, what exactly causes cystic acne? Cystic acne is actually the same in terms of pathogenesis compared to comedonal inflammatory types of acne, apart from the fact that individuals with cystic acne are probably genetically predisposed to the condition, whereas in people who suffer from comedonal or papular types of acne, they may be experiencing a physiological change in their bodies, for example, during puberty, that leads to the onset of pimples. If an individual in your family has had a history of cystic acne, and especially if they've been on treatment with a medication known as isotretinoin, it is highly likely that if you suffer from acne, that your acne can be severe as well. In terms of effective treatments, it's important to highlight that when an individual is diagnosed with cystic acne, most dermatologists would recommend starting on this medication known as isotretinoin. There are, however, contraindications to this medication. If you are pregnant, breastfeeding, or planning conception, we do not give isotretinoin because it's teratogenic, it's category X, which means that it can cause fetal abnormalities. In individuals with pre-existing liver disease, or if they're hepatitis B carriers, it's important that thorough evaluation is carried out, preferably in conjunction with an attending gastroenterologist, to ensure that there isn't underlying liver disease that would cause further abnormalities to arise during the course of isotretinoin treatment. If you have a history of familial hypercholesterolemia, which is high cholesterol inherited on the basis of genetics, then treatment of isotretinoin may be a bit tricky because one of the side effects is that it increases your cholesterol levels. Apart from that, isotretinoin is actually very effective. Some of the problems that arise during treatment would be dryness of the lips, the eyes, a condition of the lips known as cheilitis, a more severe form of lip eczema, may arise from isotretinoin treatment because one of the primary ways isotretinoin works is by suppressing the sebaceous glands. Now, the lips are considered mucocutaneous type of skin, which means that it's thinner, it's more fragile, and isotretinoin can cause the development of lip eczema. Hence, it's important to ensure that proper lip care, and it's more than just applying Vaseline or paraffin in the case of an individual on isotretinoin, but using a ceramide or phytoceramide-based formula that repairs the lip barrier. In my practice, we use one that is based off the phytoceramides derived from plant seed oils, and also an anti-inflammatory formula with grapeseed oil. These are antioxidants that function in a way that mimics the activity of a mild steroid. So all this can be very helpful in preventing lip eczema from arising during the course of treatment. Another moderate contraindication would be an individual with pre-existing eczema. Now, if you have severe eczema, then you should not take isotretinoin. However, if your eczema is mild or moderate and is currently not flaring up, then your attending dermatologist may consider giving you the medication. However, it's important to note that a good 70 to 80% of patients with pre-existing history of eczema, when they start isotretinoin, will experience a flare of the eczema. And most dermatologists will be very aware of that. And prompt management, either in terms of reduction of dose of isotretinoin or treatment of the concomitant eczema with a topical steroid with wet wrap treatment, is necessary to bring it under control. Is isotretinoin safe in breastfeeding or pregnancy? The answer is a clear no. However, after you complete the course of isotretinoin, we typically state that it is safe to commence conception about a month after stopping the medication, because that's when all the medications wash out. I think it's also important for us to talk about how isotretinoin affects your skin. It is a medication with a near 100% cure rate, primarily because of its ability to block oil production. But this cure rate is very much dependent on the individual's ability to tolerate the medication. Photosensitivity is one major side effect that comes on an individual who starts taking isotretinoin. And because the way isotretinoin works is by way of cumulative dosing, meaning that you have to reach a cumulative target dose based on your body weight, and that's in order for it to be effective, rather than just taking it, say, once a day for a period of a month or 2 months or 3 months. It means that your photosensitive side effects are also dose dependent. In a tropical country like Singapore, right at the equator, we get 100% of the sun's UV rays. That also means that you can develop a lot more of the photosensitive side effects. In my practice, I have not been able to give doses higher than 30 or 40 milligrams simply because of the amount of UV that Singaporeans are exposed to. Now, if you look at the studies done in European countries or in the US, you find that the doses are a lot higher. Other than, if you were, if you had a heavier weight and you needed to reach the target dose faster, the other limiting factor is, of course, how your skin is able to tolerate that level of medication. In terms of acne scars, when you start taking Oratane, while your pimples are sure to resolve and come down, you'll find that if you had severe cystic acne before starting isotretinoin, these areas will turn into red scars. Isotretinoin does worsen the appearance of your scars. Your skin appears more fragile. There might be a lot more redness, telangiectasia, which is the appearance of blood vessels on your face, partly because of the photosensitive side effects, as well as the breakdown of the ceramide, barrier function of the skin. Because of the way isotretinoin works, it's very important that while you're on isotretinoin, you replace your moisturizer with one that contains the optimal lipid balance, something we call a prescription emollient device, or PED. It's a type of moisturizer that's formulated to behave at least like a mild steroid because it contains anti-inflammatory ingredients such as botanicals. So the important thing about isotretinoin is, yes, it is safe. It is important for individuals with cystic acne because this type of acne, unfortunately, does not respond well to any other type of therapy. You can do a combination of lasers, light therapy, oral antibiotics, and it still will be recalcitrant. You probably save yourself a lot of time, money, as well as the cosmetic disfigurement that comes with acne scarring if you are put on isotretinoin and monitored for the side effects. I feel that this is a very effective treatment for individuals with cystic acne. Well, that's it for this week's Dermatology Flash Briefing. Remember to hit that follow button on our Spotify, Apple Podcasts or wherever you get your podcasts. You can find me on Instagram at Dr. Teo Wan Lin, where I give regular updates on the latest podcast episodes as well. Thank you very much and see you guys next time.